This is an audio recording of a debate surrounding the issue of military families lacking access to healthcare in Canada, where we will analyze the Stakeholders, Military Family Services, Canadian Pediatric Society, and the Sicilian Group.
Stakeholder number 1 is the Military Family Services. Our role is to represent the affected families in the military. We are their advocates. Our key concerns are accessibility, portability, and congruence of care for military families when they are redeployed. We believe that the military should provide access to healthcare for members and their families. They have a broad understanding of the needs of military families. Our knowledge, influence, and impact are high. The Military Family Services have a key role in delivering healthcare services and programs. Our goal is to ensure we can offer programs and services that meet the needs of military families. Currently, when members move to a new province or territory, the 90-day waiting period is waived and they are able to access provincially funded healthcare right away. This removes a barrier for families to access care, especially during emergencies. In response to the Canadian Pediatric Society, we also have resources available to make finding a family physician easier, the Military Family Doctor Network. This network was created in partnership with Calion. The physicians and healthcare professionals work with military personnel and their families and are aware of the unique needs and challenges that they face. In response to the Calion Group, the majority of our services focuses on spouses, children, and parents of military personnel. We work to ensure that families have access to care by accessing waitlists before deployment and to help families help families secure a primary healthcare practitioner in their new home. In conclusion, the Military Family Services at each branch do their best to ensure families have the resources and supports they need to make redeployment easier for each member of the family and that they are able to access the healthcare services needed right away.
Children from Canadian military families have difficulty accessing healthcare when moving frequently. Spouses and children of Canadian military members do not receive health care from the military medical system, which is federally funded. They rely on the provincial healthcare system, which differs province to province. The role of the Canadian Pediatric Society is to work with pediatricians and advocate for the health of children. Their interest is from that of a national association, which is focused on advocacy for children. The knowledge level of this society is considered to be high. They have a broad understanding of the needs of children and are supported by a multitude of professionals. Their thoughts are in alliance with the Military Family Resource Center, which play a key role in delivering healthcare services to military family members. Their power and influence is considered to be medium. This stakeholder does not have direct control over making changes to the accessibility of healthcare. They have the knowledge to make recommendations to the Government of Canada in order to facilitate change. The expected outcome includes government support in tackling health inequities in children among military families. Their impact is considered to be low, as the Canadian Pediatric Society is concerned with many other issues affecting Canadian children. There are two issues outlined by the Canadian Pediatric Society which involve problems with access to and continuity of care. The first issue is Canadian military families are frequently relocated and are 4 times less likely to have a family doctor. Because of this, they are experiencing health inequities. Families have difficulty securing a physician within their communities as this is ever changing, leaving them in a position where they are challenged to access medical services. The second issue is there can be challenges with transferring of medical records, continuity, and quality of care, especially for children living with an illness. They lack access to specialties and experience extended wait times, potentially delaying treatment or diagnosis. This can also pose challenges with trying to access financial assistance. Pediatric Society is in a position to make recommendations to the government and pediatric healthcare providers to make improvements to the health of children and military families in order to address these key issues. In conclusion, it is clear that military families lack the accessibility and continuity of care when being moved from province to province. The Canadian Pediatric Society is interested in this issue because they are looking to advocate for the health and well-being of Canadian children. It is important that the health equities of these individuals are recognized in order to compose recommendations and advocate for change at the government level.
Calian Group. This is a company that is contracted to provide health care and holds Canada's largest health care contract for the Department of National Defence, delivering health services to military bases across Canada and health care provisions to Veterans Affairs Canada and the Royal Canadian Mounted Police, as stated on the Calian.com website. Their interest is to provide health care services to the Canadian Armed Forces as per contracted. The Calian Group is considered to be neutral in the matter of spousal and child health care services being provided by the Military Medical Service. They represent the employer and their employees. The level of power influence is placed as medium because this company can develop new plans and implementation suggestions for providing care to family members, potentially at an increased cost to the federal government. The Calian Group provides a service, therefore costs will need to be covered by the contractee to open the patient population commitment. While the company operates clinic settings on military bases, they also have approximately 180 clinics across Canada out of Loblaws grocer groups, such as locations in Loblaws, Superstore, No Frills, and Zehrs. There are currently over 1,800 healthcare professionals in over 60 categories of health. These professionals and locations service over 6 million patient visits per year. If the care was opened to families, who is going to pay for the extra healthcare professionals required to maintain such a high influx of patient load? Another concern is what is the impact on the permanent residents of these locations using the same healthcare providers. How will the residents be protected from any inequities that may arise because the patient population now includes a large transient community? Will the permanent residents experience inconsistencies in wait times for appointments or specialists related to the changing patient volume and needs? In closing, my opinion on the issue concerning families not receiving health care under the military medical services could pose extra costs incurred from Calian Group onto the federal government and Canadian Armed Forces. At this time, unfortunately, for the children and families involved, the cost of services to the federal government is posing an age-old issue. Where is the funding? Can change be supported in one province over the other, as per how the province has allocated their funds? Or is this type of change just not an option within this federal budget?
In response to the argument made by the stakeholder, the Calian Group, it should be the obligation of the military to support the children and families, not only the members of the Canadian Armed Forces, no matter the cost, to ensure accessibility. The Canadian Pediatric Society believes that it is up to the government to make changes to provide better care for children within military families. They do not address specifically the need for the military to provide the medical care to these individuals, although they would be in support of any consideration that would help to better support the health care of Canadian children.
In response to the stakeholder, the Canadian Pediatric Society, regarding the government should pay for the services to support the children and family members of the Canadian Armed Forces. I feel that it is also needed to be understood that the government, while it is nice to have the services provided under the same roof with the same benefits as the person employed by the Canadian Armed Forces, the government is following the standards for portability, accessibility, comprehensive, and universal care for new citizens changing province locations, the same as a civilian would experience. The families of the Canadian Armed Forces employees understand and accept the lifestyle and disruption that comes with a military lifestyle. In support with Canadian Pediatric Society, as a service provider within the healthcare industry, our company could provide the contractee, the federal government, with planning that would detail the supports required to properly staff and enable the military clinics, as well as the Loblaws groups, with the financial forecast to be able to adequately provide safe and quality services to the influx of family patient population.